everyone, my name is Katherine Jones and I work in the HLA Histocompatibility Laboratory at VCU Health. Today I'm sharing a communication plan that looks at how the federal shutdown affected the OPTN and how it created confusion and challenges for living donors and transplant patients. When the federal shutdown happened, UNOS, which serves as the OPTN contractor, was asked to pause several major oversight functions. Reports from UNOS and other health policy sources show that this was the first time a shutdown has caused this level of disruption to the OPTN oversight operations. This led to a lot of uncertainty for people connected to the transplant system. Living donors were not sure if their evaluations, testing, or surgery plans would move forward. Transplant candidates worried about delays and how they might affect their health or their place on the waiting list. Transplant centers, coordinators, surgeons, and HLA laboratories received mixed or incomplete information during the first few days. There was no single trusted place to get accurate updates, so many people turned to social media, which led to even more confusion. This breakdown in communication is the root of the problem and is what my communication plan is designed to fix. This situation touched almost every part of the transplant community. Living donors were unsure if their evaluations or surgeries would move forward, which naturally caused stress. Transplant candidates also felt anxious because any delay can impact their planning and their well-being. Families were looking for simple and consistent information so they would understand what was happening. At the same time, transplant centers, coordinators, and surgeons and HLA laboratories were trying to keep patients informed even though the guidance they were receiving was limited and changed quickly. This made it challenging for them to give clear direction. The public also saw information online that was incomplete or confusing, which added to an overall uncertainty. Altogether, this situation shows how many different groups rely on timely, accurate communication to feel supported and prepared. When the OPTN oversight functions are disrupted, it affects the entire national transplant system. This includes all major organ programs such as kidneys, livers, hearts, lungs, and pancreas. Organ matches still continue, but the oversight, guidance, and support that transplant centers rely on may slow down or become unclear. For living donors, especially those giving a kidney or part of their liver, evaluations and planning may slow down or even pause. This adds stress for donors who are preparing for surgery and for recipients who are waiting for these life-saving procedures. Even a small disruption at the national level can create confusion across all organ programs, which is why strong and consistent communication is so important. During the OPTN disruption, the biggest need was clear and consistent communication. A single centralized place for updates would have helped everyone stay on the same page. Instead, centers and labs received mixed or incomplete information, which made it hard to guide patients and plan daily work. Patients and families also needed simple, plain language updates. Even a short statement explaining what was happening and what it meant for their care would have reduced a lot of anxiety. Having a ready-to-share question and answer sheet for patients would have helped coordinators support them right away. A predictable schedule of updates would have made a big difference too. Even a daily "no new changes" message helps keep people calm and prevents people from assuming. Finally, social media needed accurate, official posts that linked back to real information. Without that, misinformation spread quickly. Overall, the type of communication that would have been most helpful is communication that is centralized, consistent, and easy to understand, and delivered on a regular schedule. This would have helped patients, donors, and transplant teams feel more confident and prepared during the disruption. These SMART goals guide the entire communication plan. The first goal is to increase understanding of how a shutdown affects the OPTN by at least 50%. This helps ensure that donors, patients, and transplant teams have a clearer idea of what to expect if this happens again. The second goal is to create a one simple communication toolkit for all transplant centers within 60 days. This toolkit would make sure every center is sharing the same information in the same way. The plan also includes building one trusted update page that can reach at least 50,000 views. This will give everyone a single place to check for accurate and real-time updates. Another goal is to reduce misinformation by 40% through consistent and easy to understand messages. The final goal is to improve donor and patient confidence by collecting feedback and showing at least a 30% increase in how clear the information feels. These goals help make sure the plan is measurable and effective. These strategies guide how the communication plan will work. The first strategy is to use clear and simple messages that are easy for donors and patients to understand, especially during a stressful event like a shutdown. Keeping the language simple helps everyone feel more supported and informed. Another strategy is to create one trusted place for updates. This helps remove confusion and make sure people know exactly where to go for accurate information. Making sure all transplant centers share the same information is also important. When centers communicate consistently, it reduces mixed messages and helps patients feel more confident. Quick updates through email and social media can also make a big difference. These tools help spread information fast and keep people from turning to unreliable sources. The last strategy is to give staff simple tools and talking points so they can support patients and donors with confidence. When staff feel prepared, communication becomes smoother for everyone. These tactics will show how the communication plan will be carried out. First, I will create a one-page explainer that uses simple language to help donors and patients understand what a shutdown means for them. This will make the information clear and easy to follow. Next, I will build a simple update web page where people can check in real time. This gives donors, patients, and transplant centers one trusted place to look. Short email alerts will also be sent out to all transplant centers so they can stay updated quickly and consistently. Clear social media posts will help reduce confusion and keep misinformation from spreading. Finally, staff will receive a quick reference guide so they know exactly what to say to patients and donors during a shutdown. These tactics support the strategies and make the plan easy to use. Visual examples help make the communication plan easier to understand. Simple icons can be used to highlight the main ideas without overwhelming the audience. Keeping the text short on each slide helps people focus on the most important parts. Using the same colors, fonts, and styles throughout the presentation creates a clean and professional look, which makes it easier for people to follow along. Images that show support, teamwork, and patient care can often connect the message to the people who are affected. Diagrams are also helpful because they can break down complex ideas into simple steps. These visuals make the information clearer and help donors, patients, and transplant teams understand what they need to know. The evaluation plan helps show whether the communication plan is working. The first step is to track how many people visit the update web page, since that shows if donors, patients, and staff are using it as a trusted source. Another part is collecting quick surveys from donors and patients to measure how well they are understanding the information. Monitoring social media helps identify whether misinformation is decreasing or if new issues are appearing. Feedback from transplant centers is also important, so we can see if the messages are clear and easy to share. Finally, comparing communication response times before and after the plan shows if we are reaching people faster. All of these measures help determine how effective the communication plan is and where it can improve. In the end, the OPTN disruption showed how much the entire transplant system depends on strong, reliable communication. When guidance is delayed or unclear, patients, donors, families, and clinical teams all feel the impact. What we learned is that having a centralized source of information, simple messages for patients, consistent updates, and clear operational direction can keep the system steady even in uncertain moments. Moving forward, improving communication is not just helpful, it is essential for protecting trust, reducing confusion, and keeping patient care safe during any future disruption.